Well, welcome everybody to the AANEM Neuromuscular Fellowship Fair. AANEM is excited to organize and host this event. The purpose of the event is to give residents an opportunity to learn a little about each of the programs and about your individual fellowship programs. So once we get done with each of the presentations, we will then go into a question and answer session so that you residents have an opportunity to ask questions. We've got 4 programs presenting for us tonight. So we have Beth Israel Deaconess Medical Center. We have Mass General Brigham, Harvard, University of Connecticut School of Medicine, and Yale-New Haven Medical Center. And I think with that, we will go ahead and get started. So Beth Israel Deaconess, go ahead and take it away.
Good evening. I'm Amy Bogle, and I am the program director here at Beth Israel Deaconess Medical Center. We offer 2 training programs here at Beth Israel. I am the program director for the Neuromuscular Medicine Fellowship. We also run a separate fellowship in clinical neurophysiology with a focus in EMG, but the training program is actually, they're quite integrated. And so I'm hoping to present both of those to you today just to get a sense of the programs because our fellows work very closely as a team. The BI has been training fellows in EMG since the mid-90s. And we initially started off with 1 fellow back in 1994, and we've increased to 2 fellows and sometimes 3 fellows a year. So it's a relatively small program. And as I mentioned, we have 2 pathways offered. So there's the clinical neurophysiology pathway with a focus on EMG. And we also have a neuromuscular medicine fellowship, which was started in the early 2000s when that became a specific board specialty. And so we have fellows who join us for that program as well. So far, we've had 51 graduates from our program as of last year, and about 50% of our graduates go on to community practice, and about the other 50% go on into academic or academic affiliated practices, with some of our most recent graduates actually joining one of the programs here speaking tonight at Yale. So we had Dr. Roy, who graduated from our program. Our training program, as most training programs, are going to be focused on really the neuromuscular disease management. And so that is really the core of our program. So almost all of our graduates, well, I should say all of our graduates are neurology trained. We have had discussions of applicants from other subspecialties such as PMR, but our training program has been neurology focused. We have had graduates from pediatric neurology programs join us as well. And so some of those, our most recent one was 2 years ago, was a pediatric neurology resident graduate. Given the focus of the training being on the treatment and management of neuromuscular disease, of course, EMG training and nerve conduction study training is a quintessential element of that. And so our training program is heavily focused on learning EMG and nerve conduction studies. We do supplement the clinical and EMG experience with weekly didactics that help to give us a little more training in the nuanced treatments, like different therapeutics for different illnesses, the genetic testing for different illnesses, and as well as biopsy, both in muscle and in nerve. And we even have training in skin, small fiber neuropathy skin biopsies here as well. 2 of our faculty members are trained in neuromuscular ultrasound, and so we have been incorporating that into our training program as well, with fellows being both participating in neuromuscular ultrasound, but also in didactics regarding this newer modality for the diagnosis of neuromuscular disease. Of course, with EMG and nerve conduction study trainings, we teach you about communication skills and making sure that your reports reflect the diagnosis accurately and communicating those results to referring physicians. And also with regards to just in general neuromuscular disease being a very multi-specialty patient population, making sure that your communication skills between different departments is highlighted as part of your training. This is just an example of our neuromuscular fellow schedule. And as you can see, it is very clinically focused. So we have Mondays, the fellow participates in the MDA clinic over at Children's Hospital. And so every Monday they are seeing patients there. And then throughout the week, we have various other clinics, either adult clinics here. One Wednesday a month, we have an ALS clinic here. So they will perform that on Wednesdays, one Wednesday a month. We also have 2 separate sessions for electives. So typically the Wednesday morning after didactic, there's some elective time. And Fridays, alternating with the clinical neurophys fellow, there's elective time as well. But as you can see, the clinics and the EMG sessions are the bulk of the training here during the week. Similar for the CMP fellow, there's a lot of EMG training with 2 adult clinics and then a session for additional CMP training. So most of the fellows do EEG, but we also have opportunities to do sleep or autonomics to complement the training, whatever the fellow is most interested in. The faculty here at BI, we are a relatively small division. There are 6 of us. The program was actually started by Dr. Rayner and then Dr. Rutkove, who joined her shortly after. Dr. Rutkove has been the chair of our division, and it was recently will be taking over as the chair of neurology as of March 1st. So he will be, we will be having a new neuromuscular chair, though I'm not sure exactly who that is just yet. But Dr. Rutkove, his main research interest is in advancing the new techniques for identifying nerve and muscle health with a particular focus on electrical impedance myography and ultrasound. Dr. Rayner's focus has been mostly on medical education. She's also interested, she was the previous director of the Clinical Neurophys Fellowship. She has a recent interest in the cardiac manifestation of neuromuscular disorders and is working closely with the cardiologists here at BI. 2 of our other faculty members are Pushpa Narayanaswamy, who is known well for her health services research and quality improvement work. But she also has particular interest in myasthenia gravis and muscular dystrophies and has been running some clinical trials within the myasthenia gravis realm recently. Dr. McElduff is has a particular interest in ALS and in particular bulbar function in ALS. And she's been working with Dr. Rutkove on using the electrical impedance myography in that patient population. More recently, Dr. Ross Mandeville has joined our staff as well, and he's particularly interested in nerve injury and restorative neurology and interested in working along with neurosurgeons to help identify appropriate nerves for nerve transfer in patients who've suffered traumatic nerve injuries or spinal cord injuries. I myself have been here at BI for about 5 years now, serving as a program director. I work closely with the residents and am particularly focused on neuromuscular education for the residents, but also general neurology and curriculum development, both for the fellows here and for the neurology residency. So gave you that background just to let you know that this is a pretty small program and we are very much a family over the year that you're here with us. Boston is, I feel sort of bad for the fellows this year given COVID because they haven't been able to explore life in Boston as we know it. But this is a great place to be and a great place to train. Here, we've got the 4 seasons. You're going to hear this from all the Northeast programs, I'm sure. There's been plenty of reasons to come and join us in Boston. But in our program in particular, life at BI is very much a family-oriented sort of feel. We have, with the 2 fellows per year, all of your work is here in this building here. This is the Shapiro Clinical Center. So we have your fellows' offices there. All of the EMG labs are there. We do inpatient consults, not infrequently, maybe 1 or 2 a week with either inpatient EMG or a full neuromuscular consult. So the hospital is right across the street from where we are. Children's Hospital, where the clinic is held for the neuromuscular fellow on Mondays, is right across the street. So this is really your home base. There's not a lot of travel around. We work extremely closely with our fellows. We get to know them personally and professionally and really strive to make sure that we are not only enhancing or strengthening their knowledge of neuromuscular medicine, but also helping them find areas of interest, helping to hone whatever it is they want to do down the road, be it community practice or if they plan to go into research or clinical trials. Some of our fellows have stayed on to do master's programs here at Harvard. Others have gone on to apply for additional grants and stay on for additional years of funded research. So one of the hallmarks, or I should say, one of the highlights of being at BI is $5 tickets to see games at Fenway when baseball is back open again. So if you have a BI badge, that's a wonderful little perk. So I'm just going to leave you. These are some of our one very remote graduate, Peter Kang, who I know well from his time at Children's, and two of our recent graduates and their basic thoughts on our program. I think it just highlights again that our program is very much here to train you in whatever path that you plan to take. So we've had, as I mentioned, pediatric trainees, we've had, and those who want to go into community practice and those who want to go into academics. And given that we are here at Harvard, we have a lot of resources available for each or any of those goals, and we are here to help you reach those. So hopefully that has answered some questions about our program, but I'll be here at the end once you've heard from everyone else as well.
Great. Thanks, Amy. That was great to see you and hear the presentation. So let me share my screen here. So hi everyone and good evening. Thank you so much for your interest in our programs. I am Amanda Guidon. I'm a neuromuscular neurologist at Mass General in Boston, and I'm the program director for our combined program. I'm here today with Chris Doty, who is the associate program director and based at Brigham and Women's, and also Hannah McAmel, who's one of our fellows this year. And I'm going to present the program now, and then you'll be hearing more from Chris and Hannah during the Q&A. So we are down the street from the BI, and so a lot of what you'll hear is very similar, but our program has a slightly different structure. So we are the partners program, and it consists of two hospitals, Mass General and the Brigham. And we are two separate departments, we're two separate hospitals, but we have a very long tradition of working together collaboratively, particularly in the realm of education and residency and fellowship training. And so most of our GME programs that we have at our institutions are joint. And so the trainees spend time at both institutions. So our program includes the two hospitals, and then fellows also spend a half day at Children's Hospital Boston. And we're a Harvard affiliated program, so all the faculty have Harvard affiliations. And we're a large program, so we have 6 ACGME fellowship positions per year. And we divide these 6 fellows into 2 cohorts of 3 fellows each. And the year is divided into 4 3-month rotations. And so each fellow spends a total of 6 months primarily at each hospital. And during those 3 months, the vast majority of your clinical activities are going to be at that one hospital. And you are at any given day, and most of the week, you're at that hospital. So there is not travel back and forth between the 2 locations between clinic sessions. We provide a rigorous training in neuromuscular and electrodiagnostic medicine. Our goal is to train people who have an outstanding clinical foundation for their next steps. And at the end, fellows are eligible for both the electrodiagnostic medicine boards and also the neuromuscular medicine board examinations. In terms of who we train, so we train fellows who come from ACGME accredited residency programs, and that includes Canadian programs. We train mostly adult neurologists, though every few years are very glad to have a pediatric neurology trainee, and we've had a couple PM&R trainees come through our program as well. So I'm just going to show a map to give you a sense of the geography. We have Boston here, and we have Mass General up in the West End. And then down in the Longwood medical area is Brigham and Women's. And you can see that it's not far away. Fellows typically live near one or the other. There's parking, or they're easily accessible on public transportation. And so people either walk, bike, take the T to the hospital, and it's very convenient. And so I'm going to talk through what I think are our key program strengths, and what we really feel like fellows appreciate, the faculty appreciate in terms of being here in our program. And the first main thing is our community. So the depth and the breadth of our faculty and fellows is really unique given the size and also the backgrounds. And I hope to share more with you regarding the backgrounds of our faculty, and then where our fellows go afterwards. And the second is our experiences. So fellowship is really about the people you're working with and the clinical experiences that you have. And our job is to provide the clinical avenues for you to develop as a neuromuscular expert and confident electromyographer. We have a long tradition of strength and muscle histopathology as well, and fellows perform biopsies. Other strengths include that fellows consistently comment on are the fellow cohorts and the camaraderie and lifetime collaborations that happen within the cohorts, and then the structured didactics, which support our clinical activities. And as Amy mentioned, the Boston and New England region for a couple reasons. One is our catchment area, which is very large. Patients, for people who are not from the area, patients come from Maine, New Hampshire, the entire state of Massachusetts, Rhode Island, and then for some subspecialty care nationally and even internationally, as we really see a variety of patients. It allows us to see patients and be the first neurologist or the first neuromuscular specialist who sees them and have that experience, and then also be in the experience of being a second or third opinion for patients who are really more complex. And then we'll talk more just about the benefits of living also in the Boston, New England region. So I'm going to talk through and introduce you to our faculty and briefly what they specialize in and the role that they serve in our fellowship. So at MGH, Bill David is our division chief. He's been the division chief for almost 15 years, and he focuses on ALS and electrodiagnostic medicine and general neuromuscular disease. I joined faculty in 2013 and focus on education of fellows, myasthenia gravis, and EMG and ultrasound. Reza Said Sajjadi is faculty who focuses on inherited neuropathies and runs our CMT clinic. Paloma Gonzalez Perez is a graduate of our program. She runs the muscle clinic, the adult muscle clinic at MGH. And Kathy Chong is a partners neurology, partners physiatry, and neuromuscular medicine graduate. And also staffs the muscle clinic with a PM&R focus, and also focuses on nerve injury and works with our neurosurgeons here. Leanne Burton is a recent grad. She focuses on myasthenia and acquired muscle disease, and she has a training grant for training in therapeutics. Virginia Clark is our wonderful neuromuscular nurse. And so in terms of our general neuromuscular clinic, the faculty who fellows work with and both in clinic and the EMG lab are predominantly Bill, myself, Reza, Paloma, and Kathy. In terms of our pediatric neuromuscular clinic, David Dredge, who's a pediatric neurologist, and Kathy Swoboda, who is neuromuscular trained with a focus in SMA and genetics, staff that clinic. We have a very large ALS group, and the Healy Center is one of the largest clinics in the country and the world. This was founded by Merit Sukovich, who's our chair, and our current ALS division chief is James Berry, who went through our program and was a neurology chief resident. He and Bill David staff the ALS clinic, mainly with fellows, and then the other faculty, all of whom actually trained in our program, are rotating faculty for the other fellow. In terms of our faculty at Brigham, Tony Amato is the division chief, and he was the first fellowship director. He was the fellowship director for 20 years, and then passed over the torch. He and Bill directed the fellowship, and now Chris and I. And he is a renowned expert in muscle disease and also general neuromuscular disease. He does the muscle biopsies and runs the histopathology conference and staffs the EMG lab. Chris's focus is medical education and general neuromuscular disease with a focus on immune-mediated disease. He works closely with the residents as well, and staffs the EMG lab. And he's the neuromuscular clinical director at the Brigham. So Tony and Chris are the primary faculty who you work with at the Brigham. Vijay Ganesh, Jumi Saw also will do some clinical work and EMG lab work with fellows, and then Steve Greenberg and Kian staff the EMG lab. When fellows are at Boston Children's, they work with Basil Darras, who is there. And so what does the fellowship look like in terms of a weekly breakdown? Well, about 50% of time is spent doing EMGs and 50% are in clinics. And that's both at the Brigham and MGH. And one of our fellows created created a word cloud of all the different disorders that she had seen over the year, and reflective of her list of patients. And so you can see that there's a real wide variety of neuromuscular disease. And that is because patients have a longitudinal neuromuscular fellows clinic, and the patients are selected to be the most educationally valuable for the fellow in myasthenia, nerve disease, muscle, depending on the faculty who's staffing the clinic. We are a CMT Center of Excellence and a Myasthenia Partners in Care clinic, and so have that referral base and do research and trials in those areas. Fellows spend half a day in the ALS multidisciplinary clinic per week, and then half a day at the pediatric MDA clinics. We do EMGs and consults, inpatient EMGs and consults, both at MGH and the Brigham. Typically the consults are about one a week or 3 to 4 a month, and then the EMGs. There's no weekend or evening call, and there's no other consult responsibility for the fellows. And fellows have an option to participate in clinical trial visits if that's an interest. And so this is a photo from the workroom at the Brigham. The EMG lab and all of the clinics there are in the new building for translational medicine, which was built in 2016. It's a very modern, comfortable facility with the latest EMG equipment. All of it is hardwired to be on the network. Our volume is high, so we have an average of 36 EMGs per day between here and the Brigham, and we have 4 rooms which are staffed at one time at the Brigham, and 6 rooms here. Fellows do approximately 2 to 3 EMG studies per half day with the guidance of 1 to 2 faculty members. And so our EMG lab does approximately 3,500 studies per year. We have additional procedures that fellows receive training in. So they perform nerve and muscle biopsies. Muscle biopsies are open at the Brigham and core biopsies here at MGH. So fellows get experience in both. We have a faculty member here, myself, and then also at the Brigham who are trained in neuromuscular ultrasound. And so fellows receive training in that. I perform single fiber EMGs along with Reza. And so in the second half of the year, we involve fellows in those studies, and then fellows complete a scholarly project. If there's interest, there's opportunity to gain experience in EMG-guided botulinum toxin injections and autonomic function testing. Bill David runs the autonomic lab here, and they perform approximately 350 studies per year. Our structured weekly curriculum is a real strength of our program that we've developed intentionally to run throughout the year and start with more foundational topics in electrodiagnostic medicine and then move to more general topics. This is an activity which is combined. So all the fellows attend the conference on Wednesday mornings. During the week, there's also a nerve and muscle path conference at MGH and a separate one at the Brigham. When fellows are at MGH, they have an academic half day on Thursday morning, which starts with muscle biopsy conference, includes optional grand rounds, and then a weekly waveform conference. Waveform conference is run by Bill David. It's one of the highlights of everyone's week. All the faculty fellows look forward to it. It's a time where we go through the most interesting cases of the week. We look at live plays, we analyze the approach to the design and interpretation of the studies. And really in retrospect, many fellows say that it was one of the most valuable portions of the fellowship, and several have sought to incorporate it where they go afterwards as a didactic modality. There's the option to also attend neurology grand rounds or morning report or neuropath conferences to keep interest in general neurology at the same time. So in terms of our fellows and our current cohort, we really seek to train people with a variety of different backgrounds and interests and support them towards their goals. So we have fellows who are interested in academics, being a medical educator, fellows who are interested in research, in clinical research or basic science research, and others who are interested in practice. And we really seek, everyone receives the same training, and we seek to provide basic training with a focus, an added focus on what the goal is, and we seek to provide opportunities to develop those interests. From the top down of our department and neurology residency and in our fellowship, we believe that a culture that promotes diversity, inclusion, and respect is essential for learning and optimal patient care. And really working with our group of fellows is one of the highlights for many faculty. We are just amazed by the accomplishments of the incoming fellows, and really it's exciting to see how they develop over the year. And so in terms of where our fellows go, in terms of the year after fellowship, approximately 70% of fellows go directly into academic positions or academic affiliated. About 17% pursue a second fellowship, and sometimes that includes a master's degree. Those fellowships are diverse, include ALS, palliative care, an autonomic fellowship, and then 15% go directly into practice. You can see that the geographic representation is broad across the US. We have 3 recent graduates who practice in Canada and some international graduates in Singapore and in Ireland. In terms of scholarly projects, fellows have a half day to work on their scholarly projects per week, and those can be quite variable. And I've just included a sample of papers from the past 5 years and projects, which include educational enduring material and other papers. And in bold is the fellow's name, and then underlined is the faculty. So all of these projects were done in conjunction with faculty who aim to support the fellows in their writing and their research. In terms of we have some fellows who are interested in training and clinical research training after graduation, and they've been successful in obtaining funding through the competitive programs like the AAN, the MDA, the AANEM. We've had 2 fellows come in with R25 grants, which will translate into further research after graduation, and then opportunities to do another year of fellowship/faculty with training in clinical trials and therapeutic development. Boston is a great place to train and a wonderful place to live. Our fellows enjoy spending time with one another, even during COVID. There's been a lot of exploration of outdoor areas. This is a photo of Chris and myself on a little hike with the fellows in the late fall. And really Boston has the feel of a smaller town with the resources of a larger city and access to beautiful outdoor activities like hiking, skiing, biking, the beach. It really has all those things. If you like sports, the Red Sox and other professional teams are here. There's a large music community with Berkeley School of Music and other venues when we return to seeing concerts. If you have children, it's a wonderful place to have children. This is one of my favorite parks in Boston by the Children's Museum overlooking the waterfront. It's just the more time you spend here, I think the more the region provides. So we invite you to go to our website to learn more about our program. Our GME also put together really nice tours of our hospitals, and then also some thoughts about training here, which are good to get more of a sense of our programs. And we're available along with our program coordinator at any point to talk more about our program. Thank you so much.
All right, good evening, everybody. Thanks for joining us, and thanks for the AANEM for hosting this great opportunity, the Fellowship Fair. It's been really exciting. My name is Matthew Imperioli. I'm the program director at UConn Health. And let me tell you about our program. So on the call with me also here is Dr. Jula Ksadi. He's the attending neuromuscular specialist at the Connecticut Children's Hospital. Our fellowship is a fairly new fellowship. It was started in 2012. It's a 1-year neuromuscular medicine fellowship, and it's ACGME accredited. We recruit 1 fellow per year, and we welcome applicants from adult and pediatric neurology, as well as PM&R residencies. We had 1 former PM&R graduate in the past, fairly recently. Our program is at UConn Health, but is also a collaboration with the Hospital Special Care. And the fellow rotates at the Connecticut Children's Hospital at Dr. Ksadi's MDA and CMT clinics there. So the faculty associated with the program is listed here. As I mentioned, I'm the program director. There's Dr. Anthony Alessi, who's neuromuscular trained and specialized in neurosport and EMG. Dr. Catherine Alessi is a former graduate of the program and neuromuscular specialist. Dr. Fernanda Weinstein Younger is a neuromuscular specialist who joined us a few years ago. And then there's Dr. Joseph O'Keefe. He's a physiatrist and does neurophysiatry here at UConn. And then right down the street, which I'll tell you about more in a minute, is the Hospital Special Care. There's Dr. Kevin Felice and Dr. Charles Whitaker, both neuromuscular specialists. and Dr. William Pesch, who's a PM&R neuro rehab specialist. And then within a mile away, there's Dr. Julia Exati, who's a pediatric neuromuscular specialist at the Connecticut Children's Hospital. So the primary aim of our programs kind of listed here are our goal is to train competent and compassionate neuromuscular specialists and provide them the knowledge and the skills to become leaders in the field of neuromuscular medicine. So to meet this, our goals are using up-to-date electrodiagnostic testing, utilizing our comprehensive didactic curriculum, provide the clinical skills and cognitive tools to practice evidence-based neuromuscular medicine, research opportunities, as well as provide a environment for our fellows to explore their interests in neuromuscular disease and promote wellness and self-care. So UConn Health takes special interest in diversity and inclusion, and I kind of just included our diversity statement. The program works between GME and the institution to recruit and promote diverse faculty members and applicants. So UConn Health, it's located in Farmington, Connecticut. It's the home of UConn's medical and dental schools. On it is John Dempsey Hospital, which is a 169-bed academic hospital. You can kind of see in this picture, fairly new. I think it just opened in 2015, kind of in addition to the older part of the hospital. On the bottom left, you can see our outpatient pavilions, and also on the campus is Jackson Laboratory, which is a genomics research center. So you may ask, where's Farmington, Connecticut? Well, it's pretty much in the middle of the state. You can see fairly halfway in between New York City and Boston. And here's a picture of the some of the neuromuscular team at UConn Health. Pictured on the flanking sides is Jody and Alex, our nerve conduction EMG techs. So the UConn Health Neuromuscular Center is actually located, connected to the hospital, where our neuromuscular office are, our EMG and autonomics lab, our multidisciplinary clinics and clinical trials. So it's pretty convenient having the Neuromuscular Center attached to the hospital. So it's easy to either bring patients over to our lab to study, or go over there if we had to do an EMG and inpatient or do a consult. The lab does all the EMGs for our health system, where we do about over 1,200 right now a year. Our autonomic labs there, which is growing every year. And our offices are located there. So you can see in the picture, it's kind of in the round. So on one half of the picture, towards the right of the screen, is our clinic offices. And on the left side is our EMG offices and autonomic lab. So it's easy if we have a patient that we need to get them in for EMG right away. It's not too hard to walk across the hall to the other side. In the centers as a staff to coordinate visits, and our offices are kind of in the back too. So just a picture of one of the EMG rooms. And we use the Natus equipment. We also have Cadwell as well, so you get trained on both the Natus and Cadwell systems. Here's a picture of the autonomics lab with the tilt table, QSART, QSweat, and the devices do continuous blood pressure monitoring and heart rate variability. And then there's a picture of one of our office rooms. We're on Epic, like most of the other programs here tonight, so it's easy to share data from all the other programs locally. And I think most of the hospital systems in Connecticut are on Epic too, which makes it really easy if patients go between hospitals. So in collaboration with our program at UConn Health is the Hospital Special Care. located just a few miles down the road, next town over in New Britain. So it's a short drive. The hospital special care is the fourth largest freestanding long-term and acute rehab hospital. They offer advanced care and rehab services for a variety of conditions, including traumatic brain injury, spinal cord injuries, and neuromuscular disease. They also have various outpatient centers. The hospital special care is home of an MDA care center, as well as an ALS Center of Excellence. They have their own general neuromuscular clinic and EMG lab, and they're also very active in clinical trials. They're one of the sites of the Healy ALS platform. Here's a picture of the multidisciplinary team at the hospital special care. There in the picture, Dr. Felice and Dr. Whitaker up front, as well as the other physical therapy, occupational therapy, nurse, pulmonology, and other rehab services with them. And then less than a mile away from the UConn Health campus is the outpatient offices for the Connecticut Children's Hospital. There, Dr. Aksadi has his pediatric neuromuscular clinic. He also has his MDA care center and CMT clinic, as well as his SMA care program. Here's a picture of him cutting the ribbon a few years ago when he opened his MDA care center down the street from us. So kind of a breakdown of a typical week at the program for the fellow would be Monday morning and Tuesday morning having a neuromuscular clinic. So their clinic is a continuity clinic, so they can see the same patients and follow longitudinally over the year. There's also some follow-up for the supervising attending too that the patient can see from their former patients. And then in the afternoon, there's EMG. It's both on Mondays and Tuesdays. And if a patient needs to be studied earlier, like I mentioned, it's not too hard to bring the patient right over to the other side of the office to do an EMG. Every Wednesday in the morning, we have our didactic session that runs through the year. The didactics are also done Friday mornings at the hospital special care. The curriculum is coordinated between the two sites and runs throughout the year, starting with kind of like a boot camp about assessing neuromuscular disease and electrodiagnostics, and kind of progresses through topics throughout the year. Wednesdays, we have mostly EMGs all day. Thursday morning, the fellow has the opportunity to attend the neurology grand rounds and some academic time for their own research as well. EMGs in the afternoon. And then on Fridays, the fellow goes over down the street to the hospital special care to participate in their MDA clinic, as well as in their neuromuscular clinic. They may also do EMGs there if needed at the hospital special care. And the fellow also has opportunity to participate in their ALS clinic as well. So throughout the year, there's inpatient EMGs that may be done, where we can either do them in our office if the patient's stable, or bring them our machine over to the hospital if unable to do so. There's also autonomic testing that the fellow can get comfortable performing by the end of the year, skin biopsies as well. And then part of the EMG lab too includes training on rep stims, single fiber, and the whole complement of EMGs. The EMG is a mix of orthopedic cases, neuromuscular cases, our own, and outside referrals. So it kind of runs the whole gamut of electrodiagnostic medicine. And then every month, Dr. Aksadi has his MDA clinic that the fellow will rotate on Wednesday, as well as the CMT clinics quarterly there. So like I mentioned, the Didactic Series runs throughout the year at both UConn Health and HSC. The fellow is asked to present some topics, including interesting case presentations. There's a journal club monthly as well. And as well as our monthly NeuroPath conference, which we all used to meet in person, but now is done via Zoom. Here's a picture of our NeuroPath conference pre-COVID times with Dr. Wu, who's our NeuroPath specialist running the conference. So there is some play with the schedule, and depending on the fellow's interests, there are electives in neurophysiatry, both at HSC and UConn Health that the fellow can rotate through. The fellow also spends some time with Dr. Wu in neuropathology. Depending on interests, the fellow can also rotate in our chemo denervation Botox clinic at UConn Health. We're starting to develop our nerve and muscle ultrasound. There's an affiliated neuromuscular specialist who is doing nerve and muscle ultrasound that the fellow can rotate with. And in particular, if the fellow wants to spend more time with genetics, there's a genetic specialist both at adult and pediatric neurology that the fellow can rotate with. And Dr. Whitaker at the Hospital Special Care was trained as a geneticist before he went to neurology and neuromuscular medicine. So teaching opportunities, the fellow will have plenty of opportunity to work with the neurology residents who are rotating at UConn and HSC, as well as teaching with medical students. The fellows have historically presented at the neurology resident didactic sessions, such as presenting about muscular dystrophy, things like that. So encourage that. And fellows generally will present at a national conference yearly as well, their research project. And then overall benefits, neuromuscular medicine, generally there's no calls or weekends, so that, I think that's makes for a nice year. Fellows have money when they start through the GME for books and educational funds, and there's also funds to travel for travel costs to attend national conferences. So what's it like living in Connecticut or central Connecticut? Like, well, much of New England right now, it's pretty snowy, but in the winter, there's a few mountains around here. If people are interested to go in skiing, snowboarding, a short trip down the road, or up north and for some of the bigger mountains. During the summer, there's a lot to do. There's lakes and rivers to go hiking around, canoeing, tubing. We're not too far from New York or Boston. Hartford has its own downtown life. There's restaurants, museums, there's the Bushnell Theater, there's other shows, minor league hockey and baseball teams. There's a lot of nice towns to live in the area. You can live right across the street in apartments and condos from UConn Health, or plenty of towns in short driving distance. Good schools in the area as well. And that's my presentation. Thanks for your attention.
My name's Dan DeCapua. I am the Neuromuscular Fellowship Director at the Yale Neuromuscular Fellowship in Yale-New Haven. I'm also the Clinical Director. I'm cognizant of the time, so I'll try and give you the highlights of our program. It's mainly focused on evaluation of clinical adult patients, although you will rotate through the pediatric clinic 2 days a month. So the EMG and clinic balance is about 50-50. You'll see both neuromuscular consults on the outpatient as well as the inpatient realms. We're connected to the hospital. So in general, we'll try and actually bring the patient down to the clinic or the EMG lab to do both the consult and the EMG if necessary. Generally, we can only do that if they're stable on the floor. If they're in a step-down unit or the ICU, we have to bring the machine to the bedside. The EMG lab is quite busy. You'll probably do over 600 studies as a fellow throughout the year. And those will be from basic nerve conduction studies focusing on entrapment neuropathy, spine disease, to more complicated brachial plexopathies, neuromuscular junction disorders, We do some autonomic testing, but it is limited. And 3 of our neuromuscular faculty are actually neuromuscular ultrasound trained. So you will have the opportunity to learn that as well. While you're here, you'll participate in a scholarly project, and you'll have multiple faculty members, both in the neuromuscular division, as well as our research realms within the university. So anything that you're interested in, you more than likely can find someone else at the university who's also interested in that, and we can pair you up with them. Current clinical trials that we have going on in ALS, inclusion body, myositis, and myasthenia gravis. We have 2 ACGME accredited positions. The salary for the 2021-22 year has not been set yet, but that's the current salary for the PGY5. It's a generous benefits package, includes medical, vision, dental. There is a Yale-New Haven Hospital match for retirement, which again, you're only going to be here for a year, but at least you can get started. There is a $1,400 educational fund as well, and that can be used for all sorts of things, from books to license fees, testing fees, etc. If and when national meetings start in person again, there is up to $2,000 to attend a national meeting as well. The highlights: you get 4 weeks of vacation to take advantage of all that the Northeast has to offer. You've seen a lot of pictures of that. New Haven is just a little farther south. We're, I guess, both alphabetically and going north to south, the lowest program here tonight. There'll be one-on-one teaching with neuromuscular attendings throughout the year. We do have elective time, which the fellows have taken advantage of with pursuing Botox. Some who are interested in private practice have focused more on EEG reading. Others have spent time with PM&R or pain medicine. Depending on what your interests are, there's been lots of opportunities for using your elective time, and that's again sort of one morning or afternoon a week. Our Friday afternoons are mainly where our didactics are, and that's on a rotating basis. We'll have our biopsy conference going over neuromuscular pathology. There's also M&M, neuromuscular M&M, which sometimes will turn into more of an interesting case conference. We have journal club and EMG conference as well. You'll rotate through a skin biopsy clinic, an ALS clinic. I mentioned both the adult and pediatric MDA clinic. There are really multiple teaching opportunities. We will have residents that'll rotate through the EMG lab and occasionally through the neuromuscular clinic as well, but we do our best to not have residents in the same clinic that the fellows are in, so as not to dilute the experience for either, really. And let's see here. We have 12 plus faculty, and so you'll get to work with us. We all have our specialties, from neuromuscular to ALS clinic to the myasthenia gravis clinic. Some are more focused on electrophysiology, and so they will do more spend more time in the EMG lab and get down into the nitty-gritty of the electrodiagnostic studies, and focus on neuromuscular ultrasound, correlating that to the EMG. Neuromuscular ultrasound is probably starting to take a little bit of a larger role for evaluation of entrapment neuropathies, particularly when there's a strong clinical suspicion for entrapment neuropathies, but it doesn't necessarily show up on the nerve conduction study. And life in New Haven. So it's actually more of a college town, I would say, than it is a city. I think it's probably known best for the food and the pizza. There are microbreweries. There is a lot of outdoor activities. New Haven is on the water, although it's not quite the open ocean. It's the Long Island Sound. There's numerous museums and theaters around. We do not have any professional sports teams, but if you enjoy tennis, there is the Pilot Pen comes there, comes to New Haven every year. And I think at this point, because I'm pretty cognizant of the time, I may just open it up for questions.
So let's go ahead and open it up for questions. Sherlyn Atkins has been asking me to ask all of you, what drew you to neuromuscular medicine?
I was going to say, for me, I'm a person who has a research background, and really, for me, the electrodiagnostics were something that allowed me to keep the feel of having real-time data in my hands, and allowed me to kind of use that to complement my clinical examination in a way that other fields in neurology really couldn't. There's a lot of the data gathering and the understanding of what you're looking at and seeing it in both its pathologic state on the EMG and nerve conduction studies, but also the treatment options and how that determines what treatment options you're using for a patient. I thought that was really wonderful, and really what drew me to the field.
As a resident, I feel like you spend a lot of time in the central nervous system, seeing strokes, epilepsy, things like that. So I really wanted to develop my skills in the peripheral nervous system to kind of round out my skills. And plus, it's really nice to have EMGs, like Amy said, to kind of complement your exam and kind of break up your week, your clinic workflow, and keep things fresh for the week.
As a pediatric neurologist, from Connecticut, what is really a game changer in the last couple of years, the genetic understanding and molecular biology of neuromuscular disorders and the fascinating new genetic-based treatments. And it's just a really exciting time participating in such a new treatment options, which really make the major difference in terrible diseases such as spinal muscular atrophy, Duchenne muscular dystrophy, and it's coming up in Charcot-Marie-Tooth disease also.
I'll just quickly add that, neuromuscular is one of the most diverse areas of neurology, and as somebody that is, pretty clinically focused, I think it's great that in the same clinic, I can have a carpal tunnel syndrome, which has a great prognosis, fairly straightforward. I can have a myasthenia gravis patient that I followed for, years on immunosuppressive therapies that need titration, and, we can have an end-of-life muscular dystrophy patient, right? So it sort of challenges all aspects of your clinical care, I would say. And then on top of that, you get to do a procedure in terms of EMG or ultrasound, anything else that you might like. So it's a really, it's hard to get bored, I would say, in a week in neuromuscular practice.
I agree. I'll just chime in. I actually liked why I was originally drawn to it was the fact that I could alternate between sort of the clinical realm and performing procedures. It was actually a sort of a nice change of pace. And I think the neuromuscular neurologist is probably the best all-around neurologist. Often whenever there is a peripheral question, we are consulted. You know, especially on the inpatient realm, they're very keen on picking up any of the central nervous system disorders, but whenever there's a really intriguing case that they can't figure out, they call in the neuromuscular neurologist.
So I'm going to pass along to Hannah, our fellow who joined us, if she wants to contribute. And I'll just say that, you know, where I started in neuromuscular medicine is pretty different than where I am right now. So it's been really exciting to have a field that is able to kind of grow throughout a career and develop as interests become, as interests develop and the field changes.
Yeah, I'll just say as a trainee, you know, I agree with all the things that some of the seasoned attendings have said. It's a really exciting time to sort of transition from neurology residency into fellowship. You get to learn like a completely new skill for most of us, you know, with the EMG nerve conduction study, and really get a tool sort of out of that, and then enter a really dynamic field that's changing a lot. So it's been great so far, and I think it'll continue to change in the next 5 or 10 years, even more than other fields in medicine will.
Sort of lead off with the chat question about how frequent are opportunities for fellows to perform diagnostic ultrasound. I would say at our program, we often do them just interspersed with the EMGs, sort of as needed. So if there's an entrapment neuropathy, for example, we'll add on the ultrasound in conjunction with the already planned EMG. And so it could be as frequent as every day of the week, depending on the cases that come in. And I would say in general, really depending on the interest of the fellow as well. You know, certainly in our lab, if a fellow is interested in doing an ultrasound on a particular patient, we would rarely say no to that opportunity.
For our program, the way that the ultrasounds are scheduled, they're scheduled typically in advance. So the patient will be coming in for an EMG and ultrasound at the same time, based on how the patient is referred in. So you can look at the schedule and typically know if there's going to be an ultrasound performed that day. And so you can come, and typically there's 2 of our attendings who do them routinely. And so you can look at those schedules and join them for those ultrasounds. And it's typically on the average 1, maybe two per week, if depending on the attending.
I mentioned at UConn, radiology has done more ultrasounds than neuromuscular, but something we're developing. There's one associate faculty member that's doing ultrasound, but we hope to develop it more moving forward.
In addition to at the Brigham, at MGH, we are similar to Beth Israel in that we schedule our ultrasounds, usually EMG and ultrasound, or ultrasound in patients who've had a prior EMG. We're using it mainly right now for entrapment neuropathies, and rarely in polyneuropathies. There are some faculty who are doing some ultrasound on muscle on a research basis, but we're not routinely doing muscle ultrasound.
All right, well, we'll go ahead and wrap it up. So residents, if you think of any questions for either the programs or any of the fellows, please reach out to them. They did give you contact information. You're also welcome to utilize the portal, which does have a communication feature. So please reach out to them, ask them questions. They'd love to hear from you. I just want to thank the program so much for your participation tonight. We do know how busy your schedules are, so thank you very much for taking the time to share all of your information with all of the residents, fellows for sharing your experience as well. Just a couple of reminders for upcoming events so that everybody is kind of aware. You have started to see some advertisements for the Spring Virtual Conference. That is March 2nd through the 5th, so registration is open for that. One thing I want to make sure is that fellows and residents are aware that you do get to attend that meeting for free. So it's a perfect opportunity to attend a session without it costing you any money. So please take advantage of that. The neuromuscular and EDX self-assessment exam is May 3rd through the 10th. So registration is open for that as well. Please contact your program coordinator to get signed up for that. And last but not least, the popular is the AANEM 2021 annual meeting. So we're super excited to hopefully be able to see everybody in person this year. That will be October 13th through the 16th in Aurora, Colorado. Thank you very much for your participation. We do appreciate all of your time. I know the residents appreciate hearing firsthand from you about your programs. So for that, I will say good night to you all. So have a wonderful evening and thanks again. Bye-bye.